whenever you politicize public health, whenever you politicize anything, it becomes more about politics than the subject of which you originally started. Period. End of story. Now, public health, ideally, you have a public health officer who is closest to the ground, and she can look around and see what is needed, what is necessary. I think it's a good conservative principle that he or she who governs closest to those governed governs best. In this case, the public health officer working with the mayor or whomever would be making those decisions. If you have somebody who's subject to political motivations or who is unaware of a locality's particular circumstances, then that person may make a decision which is not best for the public health here. That's just kind of my observation as a physician, but I think it's borne out in my observations as a senator.